Hello, my name is David Moffat. I'm a physiotherapist. This is Ella. She's a kinesiologist who's kindly volunteered to be the subject. Today we're going to talk about taping for a rotator cuff strain. Very simple. We're going to use a specialized tape, and we'll talk just a few seconds about some of the common causes and what we're trying to achieve with the tape, so that when you're doing it, you understand what you're trying to achieve. What tends to happen, you've got the rotator cuff is made up of a number of muscles. You've got some large muscles that pull from what we call the supraspinatus, which is the spine. It attaches above the spine of the scapula, so supraspinatus. You also have the infraspinatus, which attaches under the spine of the scapula, under the spine of the scapula. And so these two large muscles come across and attach into the front of the humerus. What tends to happen in a painful situation, if you've got adhesive capsulitis, which is as a response to an injury at some point of time, that will tend to adhere to each other and to the anterior structures. And what we tend to do is, if we're in pain, we roll our shoulder forward to alleviate the pain, as you can see. And when you have the shoulder rotated forward, it no longer can glide within the capsule efficiently, or within the glenoid, which is the cup that the humerus sits in. So that becomes inefficient, creates further stretch and inflammation to the posterior muscles and shortening of the anterior muscles. So the goal of the taping today, very simple, is to pull the shoulder back, pull the head of the humerus back so that it is in the appropriate tracking position. It's almost like a pulley, and you've got a cord going over the pulley. If the cord goes off center and it rubs against the tracking of the pulley, and the pulley starts to wobble, and then the wheels fall off. We don't want the wheels to fall off. So we simply put the tape attached to the anterior part of the capsule, tape that down. We ask the patient to roll their shoulder back, 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 back. Then we put it on stretch, 50 to 70% stretch, and then we attach it to the posterior part of the spine along the line of the infraspinatus. Can you see that? Maybe rotate a little more. There you go. Okay, come back again. We'll do another overlap because it is multi-directional. So you can see the process is to pull the shoulder, roll the shoulder back. That's it. That's better. Good. Done. As simple as that. So you can turn again a little more so they can see at the back, and turn to the front. Now elevate your shoulder forward. Look at that. Beautiful. Nice scapular-thoracic movement in the correct alignment. Try to the good. And back down. Excellent. You can leave the tape on for up to 48 hours. Always be careful. If you have any itching, then remove the tape. Always remove it slowly so as not to irritate the skin. You hold the skin down and pull gently back, especially preferably after a shower. This should immediately create relief in symptoms. I hope this helps. Thank you.